Welcome to the Smart Anatomy page for professors. In this video, I'm going to give you a brief introduction to what Smart Anatomy is and why you should recommend it to your students. The main reason why students perform poorly in anatomy and physiology is due to bad studying habits. Students often study for an exam by simply reviewing their notes. Unfortunately, this is passive learning, and students will not retain the material. The second bad study habit that limits students' performance is that they don't study consistently and often cram for quizzes or exams. While they retain the material long enough to pass the exam, they will quickly forget it afterwards. As future health professionals, they must develop better studying habits. The reason why Smart Anatomy is such an effective study tool is because it helps to correct bad study habits. Smart Anatomy does this by combining active learning with a principle, the spacing effect. The spacing effect is a phenomenon where people can more easily learn or remember items if they are studied a few times over a long time span. This chart illustrates the spacing effect. Once a student learns or memorizes a piece of information, they will quickly forget it if they don't review it. But as the student learns the material, the interval at which they need to review the material grows and grows exponentially. When a student rates themselves positively, the program extends the reminder. But if a student rates themselves poorly or starts to forget the item, the program will shorten the interval between when the student sees the flashcard. Because the student is studying the information and on a regular basis and through active learning, they can more easily recall the information. And the end result is a deeper understanding of the material and far better retention. This is the interface of Anki, which is the program that powers Smart Anatomy. Students use the program by first selecting a topic and then studying. The student will then be presented with a flashcard. The flashcard will ask them to identify a structure or answer a concept question. The student will then try to answer the question. After they believe they know the answer, they will select Show Answer and the program will show the correct answer.
Acetabular notch.
The program will then ask for feedback. Based on how they rate themselves, the program will then sort the card according to the spacing principle and show it to them again either sooner or later based on their feedback. Why should you recommend Smart Anatomy to your students? Smart Anatomy has a proven track record of improving grades. If you read the reviews on my site, you will see how Smart Anatomy takes B students and transforms them into A students. There were students who were failing anatomy and physiology and, after using Smart Anatomy, developed into C or B students. Because of the active feedback the program provides and the spacing effect, students are studying consistently. This program eliminates the need for cramming. Smart Anatomy saves the student a great deal of time. It focuses on material that the student struggles in. Due to the spacing effect, the student will need to cram less and will retain more material, spending less time relearning material that they forgot due to cramming. Smart Anatomy contains over 2,200 cards in total. Smart Anatomy is also extremely affordable when compared to typical anatomy or physiology flashcards. Instead of paying $20 to $50, the student pays a $9.99 fee for a one-time download, which should last them the entire year. The goal of Smart Anatomy is to empower students with the tools to succeed in anatomy and physiology, which is often the first real medical course that students take in college. You can learn about the creator's academic background by checking the About page, or read student reviews. You can try Smart Anatomy yourself by selecting the link above. This is the end of the video, and I sincerely hope you recommend Smart Anatomy to your students. If you have any questions, reply to the email and we'll get back to you.